Hi, I'm Dr. Chad Blaker, and in this video we're going to work on extension of the spine, in particular from the base of the neck to the bottom of the rib cage. But let's get started. I really like using a foam roller more than what I have here, but just to show you that you don't have to have one, something similar to this will do. This is just a roll-up yoga mat. And so basically what you're going to do is you're going to put this up against the wall and you place it just at the base of the neck and you extend over that roll. And then you let it fall down a little bit and extend over that roll, and let it fall down a little bit and extend over the roll. And your goal is to try and go one vertebra at a time as you're going through. And what this is doing, and this is actually mobilizing the spine without putting a lot of stress in it. And when you start getting lower, just be careful that you're not hitting your head against the wall. It only takes hopefully one time of that mistake, so not to repeat it. But make sure that you're exhaling on the extension, and that is where the release is. So one vertebra at a time. There are 12 vertebrae in the thoracic spine, so you're doing that at least 12 times, and so when you're going down the spine, you've got that. Now that's to mobilize. The next thing we want to do is we want to use a physio ball, an exercise ball, and you want to get the one that's appropriate for your size and height, and there are charts online that you can look at to figure that out. Now, the first thing we did is we mobilized the spine. Now the next thing we want to do is we want to create the integration or the communication and movement in between those levels. And so in order to do that, we're going to start by sitting on the ball. We're going to roll back, bending over the ball backwards, and then we're going to roll back up into the sitting position. So it looks like this. Remember, you're going to be exhaling along the way. Make sure that there's nothing around that's going to create any kind of risk of injury, corners of tables, that kind of thing. And you make sure that you breathe, and then you're going to come up. And we can repeat that. And when we do this, we want to roll up and down the spine, looking for where it feels like it might be a little bit more difficult or challenging to bend backwards. And we just breathe into that. And then when we feel it relax, we can roll back up. Now, when we're doing this at first, keep your feet wide, and then for a bigger challenge later on as it gets stronger, bring your feet together and your arms to your side. So you can actually separate your feet and your hands for balance, and then bringing it in closer to your body for more of a core challenge. Next, after that, so that's to integrate it. So we've mobilized it, we've integrated it. Now we want to activate it. And so to do that, what we're going to do is we're going to get our chest on the ball, and we're going to, starting with arms down, as we increase the difficulty, we're going to bring our arms up overhead. But just to demonstrate, we're going to extend one vertebra at a time. My feet are wide apart for greater stability. Again, as you're ready, you can bring your feet together for a greater core workout. But you're going to extend one vertebra at a time, and you're going to extend the spine, making sure that you're breathing throughout, and then slowly unfurl that curl. So we're not just bending at one space, we're actually trying to use and activate each vertebra of the spine, making sure to breathe throughout. And then make sure that you unfurl one vertebra at a time. So those three exercises, we've mobilized it first using the roller on the wall, then, and that's the wall, not the floor. And then we've rolled on our back to integrate it, and then we turn over on our chest to activate it. Now these muscles are now ready to function. It feels really good right now to be able to stand up and freely stand without any effort. Thanks for watching.